Okay, good evening. Hey, people. We are live. How are you? Welcome to episode 84 of the Sports Therapy Association podcast. For those of you who don't know me, my name is Matt Phillips. I'm the creator of Run Chat Live, but Tuesday nights is all about helping soft tissue therapists get a little bit of friendly education. Okay, because we know after 83 episodes now that there is a little bit of misinformation out there. A lot of it is scary when you go on social media. There's people telling you that there's no point touching anyone ever again, it doesn't do anything. And there's people saying that you can't go wrong going strong. And there's people who basically will make you feel very insecure. And that's what this was born out of, really, providing support for soft tissue therapists, whether you're a sports massage therapist or a sports therapist, whether your level is anywhere from sports massage, level 3, all the way up to degree level and beyond. There will be something here for you. It is recorded live, the show. So if you want to join us live, then you can come to the Sports Therapy Association Facebook page. You don't have to be a member or anything. It doesn't cost you a penny. You just go along to Sports Therapy Association on Facebook. And I think there's a couple of questions like, what do you do for a living? And then you join us. You can do that, or you can join us via YouTube if you don't want to go via Facebook. The advantage of joining us live, if you are free at 8 o'clock on a Tuesday night, is you can obviously ask our fantastic guest questions live, and it's a wonderful networking tool. Okay, I still teach sports massage, all different levels, and one of the best forms of CPD. I'm biased, obviously, because I'm part of the Sports Therapy Association, but I say come along Tuesday nights. You will mix live always with 40, 50 people. And it's a great way of not just asking the guest questions, but chatting with each other, making some connections, people in your area. We've got the STA reps who normally show up from different areas of the UK, so you can find out who is there to help you grow your business and to provide any sort of support, especially in COVID-19 where people aren't still sure, am I supposed to be wearing a mask? Is my client supposed to be wearing a mask? Supine, prone, aprons, where'd you get your aprons from? All things like that. So that's the idea. Of course, you don't have to join us live. If you're busy at 8 o'clock on a Tuesday evening, you can download the podcast, which is I release about 2 days afterwards, or you can go to YouTube and catch the video, which I often recommend because often we've got images and you can see the guests in their full glory. This is all recorded live, and we do that on purpose because there's no editing. It's what comes out is what we're saying. Okay, so there we go. Right, people who are joining us live, here we go. We've got Catherine Reimer in the house, always first through the door. Hi, Catherine. If you can't see the screen at the moment because you're listening to the podcast, I have just brought Catherine Reimer's name up onto the screen and a fantastic photo. And there she is saying hi, everyone, with a clapping or high five emoji. I'm not sure. Becky Carroll is in the house. Hi, Becky. Glenn Murphy is here. The regulars are all bursting through the door, very excited as they get. Little Jack Russells, all of them. That's how I imagine them coming through the door anyway. So it is lovely if you can join us, particularly if you're a student, then come along. It's a great way of, my biggest thing is gently easing new information, which is probably lacking from your course, gently easing information in. I want people, the best feedback I can get on emails, and I do get feedback, and I thank everybody who takes the moment to either say thank you or tell me what you've learned, or maybe have a whinge or complain, whether it's to me or about someone else. It's all very, very welcome because what we put out here in terms of content is all to help you guys. So I do appreciate all the emails we receive. One of the nicest things is I just found that what you were saying was much easier to take on than when I was on Twitter or Facebook or Instagram, you know, or even on a course. Okay, so that's the biggest compliment I can be paid. So if you really want to kind of to win my favor, I don't know why you would, then just say that you found this a non-threatening environment and somewhere easy to learn. And I handpick my guests to give you that experience, and tonight is no exception to that at all. Shortly we will be joined once again by Sonia Fierro, fantastic therapist, originally started sports therapy, went on to osteopathy, has worked with GB teams, has a deadlift record under her belt for Italy for her age category, and has worked in all sorts of different sports, including fencing and I think ice skating and fencing, and the list goes on. So we're really lucky. If I missed one out, I'm seeing her down in the lobby just checking up. There's probably about 3 I missed out, but really lucky to get Sonia back. Sonia was with us as Robert Crowley in episode 1, where we did an introduction to CrossFit, which is still available on as a podcast and on YouTube, where we had a look at the myths and misconceptions, and we're welcoming her back. Before we bring Sonia up, then thank you to last week's guests. We had 3 last week for the price of none, because we paid them nothing. So it really was 3 for the price of none. But with the goodness of their heart, they gave up their free time to join us. We had Anna Maria Mazzieri, who a lot of you know already through her work with the school. educating soft tissue therapists across the country. And also we had Professor Mark Wilson, who has a fantastically published research, particularly into the psychology of sport, a wealth of knowledge there, PhD students under his belt. I think he's produced something like 140 odd papers all published. It was really useful and an honor to have Professor Mark Wilson along to lend his experience on the psychology of sport, what we need to appreciate the person in front of us and not just what we read in a textbook, in other words. That old thing, which hopefully a lot of you are being taught now, if you listen to your client or patient, then they'll tell you what's wrong with them. And if you listen even more, then they'll tell you how to kind of fix them. So it's all about that subjective, which we've talked about a lot. And also we had Natalie Granger, which again was a total pleasure as well. Found CrossFit later on in life, spent 10 years being a helicopter pilot in the Royal Navy, as you do, but an absolute fabulous personal trainer, and now well into her CrossFit, and gave us loads of her experience and knowledge in terms of injury. So there we go, that's all there. But the show continues. We're now at part 3 of our CrossFit month here on the Sports Therapy Association podcast. And like I say, we're going to welcome back Sonia Fierro. And tonight we're going to look at one of my favorite subjects. Anyone who knows me and follows me on One Chat Live will know I've got a bit of bias against flexibility because it's all about runners. And we might talk about that and do a little comparison. But we're going to be talking tonight about flexibility and mobility, the difference for CrossFitters. Okay, so for your clients coming in, doing Olympic lifts and other exercises like that. So do feel free to leave comments, as I always say. I'm really looking forward to bringing her up, and we'll bring her now. So Sonia Fierro. Hey, Sonia, how you doing?
Hi, Matt. Hi, everyone. Yeah, all good. Thank you.
So kind of you to come back again for seconds. It must have gone okay first time. I'm really pleased. We haven't got Robert tonight, so obviously we're mourning that. But that's great because this is one of your passions, isn't it? Flexibility, mobility.
Yes. Yeah. I think it's always been coming from a performance focused sports. So I was a figure skater growing up, and having worked in some sports that require more flexibility than the standard person would need, like diving and even fencing, has always been a passion of mine.
Fantastic, that's great. And like I said before, we've had a chat about this off air. People who know me and follow me, and quite a few of the people in the room, we've known each other for some years, haven't we? So you know that I'm a bit of a nose and a bit of a flexibility, and that's because runners, I see so many runners who are spending so much time sticking their heel up on a wall and trying to stretch it, and they're not really doing anything else because they believe that's going to save them from injury, it's going to stop them from being sore, etc., etc. So we will talk about that, but I'm double excited because I've always said that whatever you want to call it, and we'll go through the kind of different names in a minute, it all depends, it all varies very much in what you're going to use it for. Okay, so yeah. I've always used for an extreme, obviously in an argument, a martial artist is going to kick someone in the head, or a ballet performer who's going to lift their leg up and have to hold it there. That's different. Train for that. Even a footballer who's going to do a sliding tackle and their leg's going to open up, that's important. But for a runner, I've always kind of claimed running as opposed to sprinting, you don't need those ranges. You don't need much more ranges than walking. So I am infamous for going on and being a bit boring with it, but that's why I'm excited to have you along, because in CrossFit, which I know very little about, and basically we're talking about Olympic lifts, aren't we? Flexibility. Well, yeah, flexibility is important. Yeah.
Yeah, you say you're so against flexibility, but I think you think of flexibility kind of in the right way. And what you're saying is, I see runners, I work with endurance runners, their range of motion requirements will be quite limited compared to, for example, somebody that wants to get into CrossFit. We have a lot of movements that require quite a lot of range of motion. Everybody thinks of the Olympic lifting, but actually the gymnastics movements will require probably even more range. And then if we look, at the broad spectrum of sports, every sport will have different requirements. And I think people sometimes forget that flexibility, exactly like any other motor component, motor ability, needs to be targeted to what we want to do, rather than just being stretch more as a general advice. So we'll have, a runner will just need to do maybe a few exercises, maybe not much. But Then if you come into my box and you tell me that you want to start CrossFit and you can't lift your arms overhead, I know that you will need some sort of flexibility training if we want you to train safely.
Brilliant. Okay, so people are still coming in the room. Hey, Alistair,
Yeah.
Stevie, and Lisa. It's good filling up. You're obviously popular first time. This is great, and so it should be. So one thing that kind of comes up in conversation as well, and we talked briefly about this, is kind of the words we use. And for people who have come off courses, particularly sports massage courses, but even up to degree level, people have told me that it seems like people flick between flexibility and mobility and stretching, and there doesn't seem to be clear lines. Is it necessary to have clear lines, and how do you define them?
I think it's important for sure to have a bit more of a deeper understanding of what the different terms mean and how they've been used historically in research. And then the other point that I will make, I think, is really important in terms of educating our patients and clients as well. So the general kind of what is out there on social media is flexibility is passive and mobility is active. So if you're doing a stretch, you're working on flexibility. If you're learning to control your range, you're working on mobility. But actually, if we go and look at the research and even just at the dictionary definition of flexibility, it's not like that at all. That kind of dichotomy was brought on from some brands around probably 10 years ago, and then it's kind of exploded with social media, because I think we said this like in the previous podcast. Social media loves the black and white, the cross and the tick. One thing is good, one thing is bad, which is the problem I have with that clear cut flexibility being passive and mobility being active. But actually, if we look even just at the dictionary definition, flexibility is defined as the ability to bend or to be bent easily without breaking. So even the dictionary tells us that flexibility is both passive and active. And in the literature, we find research paper that will describe flexibility as static passive, active static, or it could be an active dynamic, or it could be a passive dynamic, which is something that generally we can't do, but we do as therapists. So all our mobilizations, again, confusing terms sometimes. But that's the other reason why I don't particularly like using the word mobility for what we do in the gym. Because like if I talk to a physiotherapist and I talk about mobilization, probably they're thinking of mulligan techniques. But if you're in a gym, especially CrossFit, they will think about grabbing bands and lacrosse balls and foam rollers. And there's no really, you don't really know what is, like there's not a clear definition of what exercises constitute a mobility exercise. So I still use the term, but I like to use it as a synonym for movement. So if I'm working on mobility, or if I talk about somebody's mobility, I just think at their ability to move in space, which is actually what the term has been used for historically, which is more linked to occupational therapy. So if we are assessing somebody's mobility, we're assessing their ability to stand up from a chair, take stairs, move independently in their house. Whereas flexibility, we have all these different types of flexibility that we can work on. And to touch on the point I was talking about educating our clients, I feel that sometimes it's kind of cheating them if we just try to make up something as really simple and say flexibility is passive, mobility is active, almost assuming that they can't understand how things actually work, when flexibility is actually pretty simple. You can divide it in active or passive, which means are you contracting your muscles or not? And then you will have a static or dynamic. So are you moving or you're not moving that joint? And by using the correct definitions, the person in front of me can actually already picture the exercise that I want them to do. So if I'm talking about a static passive exercise, what is considered usually stretching, you know that you're not moving and you're not tensing anything. But if I ask you to do an active dynamic exercise, you will know that I'm asking you to move and to use your muscles to move, not just, you know, a tool or something else. So I think it's really important using the correct terms, because people can understand more about what we want them to do and how things actually work in the body as well.
Smashing. Okay.
Sorry,
No,
that was a bit of a long rambling.
no, that's great. It's all really, really valid. So I'm remembering now kind of the even like level, it depends this is the thing about sports massage courses and sports therapy. It very much depends on who you go to learn it from and what teacher you have. And we've talked about this before, so it's not standardized at all. But generally, unless you have a great teacher who kind of like gets you past the exam but gives you some extra information, like me, then it's kind of what you're going to have in your syllabus for most sports therapy courses, even to level 5, is passive stretching. Most of these skills, which are still taught on most syllabuses, are going to be kind of, they'll give it an acronym, like a MET stretch or something, or PNF or a CRC, or all of these ways, which are all designed for you to increase someone's range of movement. Or you will learn a manual therapy technique like myofascial release still appears on a lot of level 5. It's like now you're ready to use another manual technique, which again is based on you identify a tightness, which will be referred to, and you use a technique to make that range of movement bigger, and so on. There's no mention really on most of these courses, unfortunately, in the syllabus for most of the well-known schools, any strength or anything like that. So yeah, I'm interested then, let's imagine that you do find that someone comes in and you give them a squat test or something, or knee to wall test, which I think some places will teach, and you see that the dorsiflexion on one person's ankle, they've done a knee to wall test, let's say, is less on one side than the other one. And maybe even they're getting a bit of niggles in that side, or you can see that is visibly less than the other one. How do you differentiate if that is down to a flexibility issue or a mobility issue, or is it not that important?
Well, this is a tough question, because not having, you know, a real person in front of you, we always make assumptions, and as with everything, it will depend. It will depend on their history, on what type of block they feel, on, you know, whether there's something else going on, whether that's the cause of their problems, or we think is the cause, or that is actually a symptom of something else that is going on. So there is always, you know, a bigger discussion about seeing an imbalance. There is some research that shows that even a minor imbalance between your ankle range, this I think was a research done on the military, can lead to more issues like hips and knees and back. But the research in terms of flexibility and injury is not that clear cut as it is on other aspects of flexibility. And there's definitely some research that shows that there might be some correlations between poor flexibility. I can think of a paper that was showing that poor quadricep flexibility seemed to be linked to a higher chances of patellar tendinopathy, for example. We do have those papers that show that, but it's not as clear cut, and often it's still difficult from the paper understanding what is the cause and what is the effect, what's the pain there, or, you know, a lot of papers around these issues, unfortunately, are not like the biggest studies. It can be a really limited number of subjects, etc. In terms of how I would approach that, again, it would depend really on what they want to do, whether there seems to be linked to any other issues. So if they were, for example, in my gym and they needed to squat, and that was something that seemed to force them on one side more than the other and causing other compensations, yeah, I could I would probably want to work on that side that is more restricted. It really depends on how restricted as well, but I would do further testing. So I would try to understand whether it's actually kind of a passive range of motion type of issue. So they really don't have kind of that tissue compliance to get into a particular position, or it's more of a problem that they can't quite get there on their own. For example, when they do certain exercises, if there is strength around, the entire lower leg, a lot of people forget to train their shins and their anterior tibias, which are actually really important to squat properly. It's all about calves. So yeah, it is a really, like, there's no clear cut process for all these things, but it's definitely something that I would look into. But yeah, it could be strength training, it could be stretching, which is more the passive static type of flexibility, and yeah, it can be just an integration of whatever they are already doing, just focusing it a little bit more on getting range through that ankle. So we can, for example, modify lunges for that person to go into a greater dorsiflexion in their lunge. What I tend to call a long lunge or a knee over toes lunge. And then I'm doing an active dynamic flexibility exercise with them, but they're still doing strength training. They're not necessarily stretching. That, is another type of flexibility training that is often forgotten. It doesn't need to be stretching.
Okay, yeah, that's great. That's just interesting to know, because you've done sports therapy and you're an osteopath as well. So, because like most, courses are trained to do, typically this is, and correct me if I'm wrong if anyone's listening live, but typically it is in the objective part, which all too often is kind of gone too quickly. But if you've done a good subjective, then you go to the objective, you do an active range of movement, you do a passive range of movement, and generally you're going to see that the passive range of movement allows you to go further. Let's imagine it is dorsiflexion, but occasionally you'll find that it won't, and that kind of suggests it might be a structural thing going on. It's just locked, it's just blocked. And that's when theory, for most massage therapists in particular, you've got to go, right, I need to refer you to someone else, maybe someone in your clinic who can look for bony issues and stuff that's going on. But if you find that there is a passive range available, and it looks like it's a soft tissue thing, maybe the calf being tight or something, then you can proceed with either some kind of passive work on them, of which you're taught loads, or maybe you can get them to do some active work as well. I'm quite interested in, do you use much passive work? Do you use things like kind of METs, or them pushing against you and then isometric contractions, all that sort of stuff, or?
So yeah, and actually isometric contractions and METs are not passive work. Those are actually an active type of flexibility. So isometrics will be an active static, because we are not moving, but we are contracting the muscles. And I definitely use them. I don't do as much hands-on anymore. I still think there is some benefit to hands-on, kind of as a gateway. When we have pain or injury, or even psychologically, some people need that. We know touch is important, but then I often progress quite quickly to some sort of active work. And I feel that METs and isometrics are a great way to break those barriers. And you can start with me in the treatment room, doing some exercises like METs type of treatments with them. And then we can turn them into self exercises where that person does the same thing or similar thing on their own. I think they're really great, because, and I think this can connect actually to a question that I see down there from Stevie
Barnes, bring it up.
So, yeah, Stevie is asking basically if we just want to increase range of motion, or we want them to learn to use what they have not been using. And that really depends on the person again. So physiologically, your passive static flexibility will always be the greatest range of motion that you have. And you can think of that as your ability for movement. I like to describe it as the container of all your movements. If you don't have a passive static range, you're not going to be able to access that movement at all. Now, in terms of whether we can control that range or not, will depend, person to person. Most people will generally have a big gap between what they can control and what they have passively. And in that case, we probably don't want to spend a lot of time doing passive static stretches, because they don't need more container. They don't need to widen that container. They actually need that to bring up the ability to control the movement within the container. So that's when I will work a lot more on static active and dynamic active type of exercises. And that can be things like, again, changing some strength training exercises to bias a certain range, or in terms of shoulders, all those kind of little movements in a prone position to learn to use your back shoulder muscles a little bit more. And we want to control that range, because if we have that big gap, usually it's more of a neurological kind of, I don't want to say issue, but there's a bigger neurological component in what we need to do and teaching the body to control that range. There will be also strength and endurance in the muscles that we need to build. They all go together, but I don't need a bigger range if I already can't control what I have. So that will be my first step. And then it all depends on, is the container big enough for what I want to do? And if it's not, then once I kind of close on that reserve, we call it a reserve, basically the gap between what you have today and what you need for the activity you want to do. That's a functional reserve, for example. Then I push the passive static more. So I widen the container and I progress that way. But I only do that as far as I need for the activity that I'm looking to do.
Okay.
Hopefully that makes sense.
Yeah, no, thoroughly. No, it's really nicely explained.
That makes sense if the answer is your question. But yeah, the goal, the focus is always, what do you need? What do you want to be able to do? And then from there, we decide how to get there, depending on what we see in the patient.
Cool. And that's a really important thing as well, because that's what kind of, for me, makes CrossFit stand out from what I'm used to working with. Because in CrossFit, let's talk about the range of movement that is needed in CrossFit. We've started off the squat with dorsiflexion, which is necessary for the depth you can get down to, the amount of dorsiflexion you've got.
I would say it's probably a little bit of one of my biases, but it's important, but it's not as relevant most of the time. Your hip flexibility will be much bigger like limiting factor for most people than dorsiflexion. A lot of people come to me as like, oh yeah, my ankles are not really flexible. It's like, I can show you a full depth squat like with shins vertical, so that's not always as much of a limiting factor, and often that ends up being, as I was saying earlier, more of a like anterior lower leg compartment weakness in the muscles that you can't actually access the range, rather than just pure dorsiflexion issue. But you can get a lot more from working the hips consistently and opening up your hips rather than dorsiflexion. Yeah.
Okay, so that's interesting. So talk us through that, because I know what you said is going to be true for a lot of therapists, where it's all about, getting that dorsiflexion. That's why you can get down. What's the significance between a hip and getting a squat, a good squat, a decent squat?
So again, it will depend on the person that we have in front, like their age and what we need. But generally in CrossFit, what we like to see is a full depth squat. So we want to see that hip crease going below the knee. Sometimes people call it also us to grasp score. So trying to go as low as we can, still maintain contraction in our muscles. Now, to do that, you are, of course, going to need quite a lot of flexion at your hip, and you're going to actually need quite good degrees of rotation. And people generally just assume that you need a lot of external rotation. Yes, you do, but you actually need internal rotation as well, because at the end of your flexion, actually you end up being internal rotation. Even if we don't see it from the outside, that's what happens in the joint itself. So the two ranges that are usually most limited are flexion at the hip and then rotation in both directions. And I see a lot more restrictions in internal rotation than external rotation, which can lead to hip pain and hip problems as well.
So if they've got restrictions in hip flexion, and meaning which is preventing them from getting low enough, we're talking about lack of flexibility then in the posterior chain.
Yeah, it would be probably posterior chain adductors play a big role into in squats, especially below parallel squats. So they are often forgotten, but they will need some work. And then, the rotation.
So obviously it depends on the person, but to give up people who are looking after athletes or CrossFit athletes here, what is the ways, what methods would you use to provide them with that ability to squat a little bit deeper? It depends, but what's some of your go-tos?
Yeah, it depends. It will be a combination. So what I would like to do is, well, the thing it depends on is what that person likes to do the most and how like they see the training. So I have some patients that really enjoy stretching, and they enjoy the passive static component. There is some members at our box that spend 10-15 minutes after each class or before each class stretching, and we don't have to remind them every time. They just enjoy doing that. So if I have somebody that enjoys that, I may include a little bit more passive static stretches if there is a limitation there, and then on top of that, adding some active static, so isometric type of work, some overcoming type of work where you push against a resistance. That's really good to increase kind of that neurological drive in an area, and then some active dynamic to finish off. But if I have an athlete that hates stretching and they get bored after 5 seconds, we know that you need to sit in a stretch, and you need to hold stretches for a certain amount of time to see a result. So I would probably work more into integrating their flexibility work in their strength work. So at that point, I will use things like, we can take the exercise itself. So if I need to improve your score, I will just get you to spend more time in that score. And I can use things like tempo, poses. I can use props where maybe I prop up your heels so that you can sit in a deeper squat, and we start working the range at your hips, and you start controlling that, and you can start getting the tissues to comply a little bit more to get into that position. And then, we work back onto going heels to the ground, etc. But yeah, it always depends on the person that I have in front of me, what they enjoy doing. Of course, as we said before, if you don't have that kind of container, it's not big enough, you will have to do some passive static stretching, but it can be like extremely minimal, and then we can work with strength training. There is some research out there, I think was actually quite recent from last year. I think was the Alfonso review, which again got really kind of misinterpreted on social media, saying that you don't need passive stretches because strength training, active static and strength training can be as good, but being as good doesn't mean that works for everybody, but it can work for some people. So there is something out there saying, well, we can use strength training to increase the range of motion, but it's something that we will have to test on the person and see how they respond to a first cycle of training, and then take it from there.
Wonderful. Yeah, I think that's a really nice point about seeing what the person enjoys, because if you give them something they really hate or they don't believe in, they're less likely to do it. Or there's obviously this kind of like involving the nervous system and making it pleasurable and fun, which we talked about as well last week and the week before, for it to actually work. So that's interesting.
Yeah, so for you to be able to get more range, you have to go kind of through different stages. There was a research that has been used a lot to say, oh, my stretching is only neurological, it's just your nervous system adapting. But there was a research from, I think it was Magnuson from 1996, but actually a lot of the research has come out in the last 10 years, has shown us that we can increase fascicle length, so we can actually increase the length of the muscles if we hold stretches long enough. Now, the problem with a lot of the older research or some smaller studies is that in general, studies with flexibility is the quality of the study and how long stretches are held for. So a lot of these studies that just show a neurological change, which is generally short-lived, we're using really short hold times on the stretching. But these more recent papers have actually shown that if you hold the stretches long enough, you actually get changes into your muscle fibers. And those changes will be, lasting longer, of course, than just a neurological one. So there's almost kind of 2 points. And I think especially with people that are really, really stiff and they really don't enjoy that passive stretching, the first one will be kind of breaking through the neurological barrier to get them to feel a little bit better in movement. And this is something I always say to my super stiff clients is, we are not looking to improve your range. I'm not looking in a month going from you barely touching your knees to touching the floor. I want you to focus on ease of movement, which to me says your nervous system is slowly letting go, is relaxing when we go into the same position, even if we are not increasing range straight away. And then once we learn that and we learn to relax in those positions, probably we can control them better, because we're going to start being able to access those positions. And then after that, we can start introducing a little bit more of that kind of muscle changing type of stretching. But to do that, we need longer stretches, 2 to 5 minutes. That doesn't need to be in one go, it's just per muscle group. So it can be built, like we can build to that. And again, it will depend on the person. Like if somebody enjoys sitting in a stretch for 2 minutes, they can go and do 2 minutes, but it's probably going to be too much and too painful for most people. So it can be repetitions of 20 seconds. But as long as in that session we build up to those 2 minutes, per muscle group, we will see some tissue changes as well.
I'll have to revisit those studies. I was under the impression that it was like you had to hold it for like between 2 and 5 minutes, and the conclusion to something I was like, who the hell's going to do that? It's just not really going to happen.
It doesn't need to be in one go.
Okay,
it doesn't need to be in one go. So like we can see those changes anyway doing shorter durations, and we can build up to longer durations. That has other benefits, because we can start working on our pain threshold and pain tolerance, etc. But again, that becomes a lot of more complex discussion and more complex programming as well, that probably most of our clients don't need as much.
How much do you find yourself, if the gymnastic elements and the Olympic lifts require flexibility, do you suggest that for some people they get involved in yoga and kind of doing some cross training, maybe periodizing? Are there advantages of going to a yoga class where you have got that? Oh, I can see from your face you're a little bit worried about that. if you're watching this podcast, you didn't see the face change.
Yeah, the yoga, there's something kind of I have absolutely nothing against yoga. It's an amazing discipline. But what I always tell people is like, if you enjoy yoga because you want to do yoga and you enjoy the mindfulness and, you know, everything else that is associated with yoga, you know, go for it. It's not going to do any harm to most people unless they are hypermobile, or, you know, that's a whole different discussion. But that's the only instance in which I would say, yes, go and do yoga. If the person says, oh, I really enjoy it and the counting down, etc., would be good for my flexibility as well, yeah, go for it. But if you're looking to just improve your flexibility, maybe for a specific exercise or a specific activity, you will get a lot more out of training specifically for that, and going on a proper flexibility training program that combines all these different type of flexibility I've been talking about, because you can get results where you don't need an hour class of yoga. You may just need 10 minutes. But if you focus on exactly what you need, you're going to get enough results, and possibly even quicker, because that's focused on what you need compared to a general yoga class. So it is, again, one of those things is like, yoga is not gonna make you more flexible for a specific activity. Even the classes called yoga for sports are really general. But an example I often talk about is toe to bar in CrossFit. So this is an exercise where you're hanging from the bar, you're using a keeping movement, so like a gymnastic type of swing, where you touch the bar with your toes and back down. Now, you don't have your legs completely straight in a toe to bar, but still, if you are not comfortable in a forward fold and you can't reach your toes, the chances of you being able to do a toe to bar are close to none. And that's something that people forget. And then sometimes they're like, oh yeah, maybe I'll do yoga and we'll have everything. It's like, well, your problem is that one exercise and that one specific, you know, back chain part of your body. So why do you want to go and do an hour if you don't particularly enjoy that, when you can do 2-3 exercises 2-3 times a week, and in maybe 3-4 weeks, usually is how long it takes to see the changes, if they are consistent, you know, improve what you need to improve.
Yeah, I was just thinking what Anne kind of mentioned.
Yeah.
I'll read it out for people listening to the podcast. So Anne Cochrane, thanks for joining us. Anne has said, where is it? Okay, so Anne says, I regularly suggest yoga moves, but it does get that funny face from the more active clients. Personally, it's helped me, and so trying to bring it back in my own routine once a week, as it helps me relax my mind from working. I think for the relaxing part, it's ironic, isn't it? Because some people are just naturally full on 100% all the time, and they can't just settle into a stretch. And sometimes these people are just, they have got restricted range, but all over, because they're just, and they're ready to go.
Yeah.
And it's funny, isn't it? Because it's that old thing where that idea that if God wanted to create just perfectly fit people, they'd rip the roof off a gym and get everyone out of the weights and put them in a yoga class, and all the people in the yoga class would go into the gym, and you get that balance. But you're led to what your personality likes, aren't you? Most people in a yoga class are kind of quite, and I don't want to generalize here and get hate mail, but you're pretty chilled out people, and you like a joss stick, you like the smell of joss sticks, and you're kind of like, so you're doing, when really, probably, not always, your body would probably benefit from some music and Metallica in the gym with some metal, but you don't like that. And it's vice versa, isn't it? So, and we know if you go to something you don't like, you're probably not going to last it. You're not going to excel in it.
Exactly,
so it's tricky.
exactly. Yeah. No, you know, yoga has helped a lot of people and has its benefit, but I always tell my patients and clients in the gym, yoga is not discipline in itself. So if you want to do that and you enjoy that, great, go and do yoga alongside CrossFit. It will definitely, you know, have some benefits. But if their goal is a specific exercise, or they are the type of person that hates like that kind of chilled and soft music, I can't do yoga. I tried a few times, and
I've got that impression.
I love doing flexibility work, but it's just I can't stand a hour class of yoga. So that it wouldn't work for me. I would do it maybe 3-4 times, and because I'm forcing myself, but I wouldn't be consistent. But I can use my strength training to get the same benefits and the same effects, and that's how flexibility training can work. Be a lot more focused. Yeah.
Okay, which brings us nicely to the focus and specific training to the stick mobility, which you're very much involved in.
Yeah.
I've read, I haven't done it myself, but I've followed, like I think I saw Paul Coker, who people will know from the show. I've seen schools which he's been involved in with that, and yourself. And it sounds really interesting. I like particularly the way you can focus and the external kind of stimuli, and it's kind of like having a goal and that all stuff. Talk for people who aren't aware of stick mobility. Where's it all come from, and where do you think some of the benefits are when it comes to increasing flexibility?
So stick mobility is a really, really useful tool, because as you're saying, it kind of gives you something else to focus on, but also having that external feedback is really important for some people, especially when we're starting working on the active static and some active dynamic type of movements. It's difficult to create an isometric contraction if you don't have a lot of body awareness, and especially at your hand range of motion. If I'm asking you to create an isometric contraction at that hand range of motion, it's going to be really, really challenging, and most people won't really know how to start. And having that external tool gives us something to push against, so it makes some of the active type of flexibility work easier to learn. Is quite useful for passive static as well, because it can support you. So you can work all the different type of flexibilities with a tool, and that's really the benefit of the system itself. And when I teach the courses, I often remind people that we don't have set exercises in stick mobility. Like, it's principles that we use, which are really similar to what I've been discussing about today. And you can integrate that with the tool, and that's why works so well. And I think that's also why people really enjoy. As we were saying, if you don't enjoy something, you're probably not going to stick with it. And stick mobility feels a little bit more like training to a lot of people that are in the gym. It feels that they're doing more rather than just holding a stretch, or they don't have to go and do an entire yoga class. They can do 10-15 minutes routines and get the same benefits. So it's really beneficial on a few different levels.
Yeah, from what I've looked into, it seems like something definitely worth getting involved in. If you're a therapist and you are looking after athletes who need that extra flexibility / mobility / whatever you like, I like the look of it. Although I will say, as a caveat, once again, some of the branding I've seen maybe from the States, you've got some super, probably hypermobile athlete there getting into some kind of position, looking up at the ceiling and doing some kind of samurai yoga pose. And you're thinking, really? But so it is, again, I suppose you can regress and scale all of this as well to the needs of the client.
Yeah, exactly.
You haven't got to go to the extremes.
That's what I just said a moment ago, is like the beauty of it is a system based on certain principles of training. Is not necessarily a set of exercises. Yes, there are some poses and exercises that are kind of the staple, but they can always be regressed. And I know a few people that are here actually have been on the course with me. We cover different stages and different ways to do exercises. Social media is always like that. You always get the most flexible person that you have, and do some cool photos with them in crazy positions. But I think we talked about this really quickly earlier. Flexibility is not just having to increase range of motion. I think a lot of people associate with flexibility with having to become a yogi or having to become a contortionist, and it's not that. I can train my flexibility. I mostly train my flexibility just to maintain what I have. not really to increase my range, because I have enough for my Olympic lifting, for my powerlifting, for my gymnastic exercises. But of course, if I don't maintain that, we know again from research that over time we are going to lose the range of motion because of a few different reasons. One is aging, and one is that if we don't use certain positions, our nervous system kind of forgets them. The receptors are not gonna hold on to a range of motion that we never use, so we would have to reintroduce that again. So just by working on maintaining my flexibility, I can stay on top of that. And you just need 2 to 5 minutes per muscle group per week to do that. And then I could be working flexibility to kind of decrease range of motion in a sense. And that's, a really long chat that we could have about hypermobile clients, where we probably wouldn't do any passive static stretches. It will be a lot more active and dynamic, so they can control the range. And we kind of want to teach their nervous system to put the brakes on earlier and earlier in their range of motion, so that they don't max out what they have.
It's really interesting to hear you say that, and we can come to Zoe, our senior question. Don't worry, it's a great question.
Yeah.
But it's so interesting and kind of, it's refreshing. I love this. This is why I love hosting the show, because I get to hear other ways of putting it. But using flexibility training to reduce the range or control the range sounds great. Now I understand where you're coming from with flexibility, because for me, I would be saying, stop this flexibility stuff. Okay, stop trying to stretch, because for me, stretch, this person is trying to touch their toes, and it's more about, I would use a terminology, let's do some mobility training instead. So let's get some control. Let's look at the movement rather than just let's look at the journey rather than the destination, if you like. Okay, we're not trying to touch our toes, we're looking at how smoothly. If I say stop, you can stop at that position and go again and stop, that kind of stuff. But yeah, like you're saying, if you use an eccentric kind of movement or with weight, with load, then you can change that flexibility. You can reduce it by doing flexibility training. It's pretty cool.
Yeah, exactly. And strength training can be a flexibility exercise, depending on where we put kind of the bias on that strength exercise, and it can teach us to control those ranges. So for example, in hypermobile patients, that becomes really handy. So we will be doing a lot of eccentric work, holds as a certain range, and then really build up on strength and endurance in the range that we want them to use, rather than increase the range. Because people generally associate flexibility with stretching. It can become confusing, but I generally just say we need to strengthen in that case. I still explain to them, well, this is what we are actually doing, but it will probably be mostly strength type of exercises. I saw a couple of questions.
Should we look at Zoe's? Yeah, let's bring up Zoe's here. What are your thoughts? Are you familiar with the app Go Wod Mobility? You probably are. But what do you think of it, bearing in mind that Zoe has just started using it and thinks it'll be a great app?
Yeah.
What do you think?
Again, so I noticed that a lot of people, when they start using Go Wod, there's another similar one, do see some benefit, but generally I find that is kind of short-lived, or it plateaus pretty quickly. The benefit is often because you start doing something consistently. So if you never really worked on your flexibility before, by joining an app like that, the great thing is that you become a little bit more consistent in focusing on the aspect of your fitness as well. And probably at the beginning, you will be seeing some improvements. What I find is that most people that use those two apps kind of plateau quite quickly, because their routines tend to be quite repetitive and quite biased towards certain positions. For example, with hips, they tend to be really biased into external rotation and pigeon stretches, etc. And they don't do as much active static and active dynamic work. There's almost never strength type of work, like eccentrics and poses, etc. So again, it's a little bit like yoga is great, and is a great like point where to start, and advising to clients, yeah, again, can be a great starting point, especially if you don't have that experience in programming and teaching flexibility training. But if you have that, I never really use them. I try them myself, and I find that, again, I spend a lot of time doing things that I don't need, and never really working other things I need. So I think the individualized and focused approach will always win. Then, depending on the person that we have in front, we can start using things like apps or yoga or other activities, if we need, to get them compliant and engaged.
Great answer. I hope that makes sense, Zoe. So yeah, there's a time and a place for these, but as soon as you're making an app which everyone can use, and obviously, you're taking out the individuality. But this is where, Zoe, like, you don't want to give all your clients an app and say, this is perfect, you don't need me anymore. No. That's a terrible business plan. But you can get them engaged in it and then say, look, this is great, but certain things are going to be better for you. So you've got to come back once you play around with it. I'll show you which exercises to use, and then get them come back with you, and you can individualize it. Okay, fantastic.
It's a short-term solution. I always prefer try to learning the most I can and educating myself. Like everything I discussed today is, it comes from a few different courses, but really mostly it comes from flexibility research that has like the best course I've ever been onto. And if you really want to dig into all these concepts, I will definitely advise to check them out, and then you can really start programming and helping people after something like that. And then or reach out. We launched some courses, especially for functional fitness soon, that will have an integrated module on flexibility.
Superb. So but before I forget, then we have to make an honourable mention to Becky Carroll, STA Regional Rep. Happy birthday, Becky, who Becky's actually on her birthday come along to listen to you, Sonia, as opposed to celebrate it in the traditional style. So thanks, Becky.
Thank you,
great.
Becky.
We'll now sing happy birthday in Italian to no, we won't. No. Thanks, Becky. Thanks for coming along. I love that. And happy birthday, definitely to you. And thanks for all your support. And it was lovely catching up with you at Therapy Expo. Right. So, talking of courses and things, particularly for soft tissue therapists, again, people who, the first thing I say to someone who's done their sports massage or sports therapy certification, particularly if it's not a degree, is you're going to need some bolt-ons. Okay, you passed your exam, you've got a lovely kind of like foundation here now, but you need some bolt-ons, and typically that will involve some education in strength, planning, scaling, and progression regression. But also now I've got something else now, which is I would have never have kind of mentioned before: flexibility training. I'm always kind of thinking you've got way too much of that, but that's because of my short-sighted look at what flexibility training is. Thank you for opening my eyes. If people do want courses, then what do you offer? What do you recommend? And when are they starting?
So, as I said, a pure flexibility course. Check out flexibility research. What I'm building with Robert Crowley and Recover Stronger is actually a course focused more on the management of functional fitness athletes and people that exercise a lot. The course will be a lot more comprehensive and covering a few different topics, from how you include your manual treatments. What are we really doing with manual treatments? What is the benefit when maybe it's better not to use that as much, etc. To your pain science. There will be a module on flexibility, a module covering the more classic movements of these sports. There are some movements, again, we can think of the Olympic lifting, the gymnastics, and then if we think of CrossFit, there is other kind of combinations like thrusters and wall balls, etc. And we kind of break them down for you, showing where things can go wrong, what to think about, and then how you can safely help your patient to go back and rehab all the way to doing really intense activities like that. Because what we found is that there is a big gap from the treatment rooms to the gyms, especially when we talk about really intense activities like CrossFit, like some functional fitness in general. And basically our course wants to close that gap, explain to people that may have not done CrossFit or functional fitness, or like you saying, like I specialize in runners, but I want to understand more about this, to really build that trust and connection with a patient that does something like CrossFit. You need to understand more about that discipline, and that's where we come in, covering all the different aspects on how to train and help people from 360 degrees.
Fantastic. And this is something which is a date's kind of going to emerge soon, or something that's still being worked on, or?
It's still being worked on. We had some logistics issues, but hopefully like late spring we'll have some initial courses running for everyone. We do have kind of waiting list that people can sign up to, and as soon as we have news, we'll send them through that. So if you are at all interested or you have any questions, you can reach me on Instagram and through the website. Yeah, I think Matt is bringing that on screen.
I'll bring it up. You can keep talking. I'm just going to bring that up so people watching the show can see the connection details. Yeah.
And then hopefully we'll have something to show really soon.
Oh, I might have chopped some. Okay, we'll see. So if you're watching the show, you can see on the screen now I've put Instagram. You can reach Sonia at sonia.recoverstronger. And then if you want to go to the website, I think I might have chopped off an M. So
no,
is it really co?
Yeah.
Really? Oh, right. I haven't. Ignore me. So yeah, www.recoverstronger.co and education.recoverstronger.co. So there. Yeah, and if people want to contact you about the stick mobility, is that the best way as well? Are there stick mobility courses still running, or have they?
Yeah, stick mobility courses. There should be a day coming out in March. I'm not 100% sure that would be me. I will probably start taking the courses again from after summer. So would most likely be Rob, that was on the podcast with me a couple of weeks ago, for the next one. If you're interested in stick mobility and you want to book a course, their website will be probably the best place where to find dates and informations. If you have just general questions on how I can help you, and if it's a good solution for you, a good addition to what you're currently doing, just DM me on Instagram and we can chat things through.
Fantastic. It's great. And as always, as with all our guests, there'll be details on the Sports Therapy Association website and links when they come out and addresses of contact. In all of the podcasts get put onto www.thesta.co.uk, and that's where all the show notes go as well. So if you're looking for contact details and websites of interest, and just head to the sta.co.uk and you'll see them all there. Right. Amazing. Thank you so much, Sonia.
Thank you.
Really nice to have you back. I don't think we've had the same guest back 2 times in 3 weeks. You've set a new record now. I don't even think Mike James has done that.
Wow. I like that.
Yeah, I think you can put that above your Italian Deadlift Championship now.
Exactly,
you can world record, the way record. So there you go. So thank you so much.
Replace the record on Instagram on my profile.
Yeah, you can add it to your profile now. Twice a guest on the STA podcast in 3 weeks. Stick around so I can say thank you to our afters, but I'll say thank you to everyone in the room now. Thanks very much for joining us live. Like I say, it's so amazing. I mean, it's not just Becky with a birthday. I mean, that's like exceptional. But it's really nice in a day where we do watch recorded TV and Netflix. No one does anything live anymore, to see people giving up their time to join us live. It's amazing. So thank you for that. But obviously, thank you as well to people who download the podcast. As always, if you do listen to the podcast, do please don't just go, that was interesting, that was really nice, I'm going to do that. Leave a rating. That's the way podcasts work. Okay, it's not a money thing. It's just so that we reach more people. We're giving out some great information thanks to our guests. But if it's only a few people who know about it, then it's very limiting. So do please leave that rating, leave a review. It'd be really, really important. Next week, we got an MBE. We've got Michaela Breeze. People who are not familiar with Michaela Breeze is actually the first woman to represent Team GB in weightlifting at Olympic Games. and she's going to be with us next week, which I'm very excited about. She actually won European bronze in 2003. She's won 6 Commonwealth medals, including 2 golds in 2002, 2006. It's big. It's important stuff. And a bronze also at Glasgow 2014. So very much sought after coach in Olympic lifts. And we're going to be talking to Michaela next week on the Sports Therapy Association podcast. So if you want to join us live, if you're listening to this, then come along Tuesday, 8 o'clock UK time. And Michaela will be with us on the show. Sonia, thanks again, once again.
Thank you for having me again.
A total pleasure. And everybody else, hopefully we'll catch up with you next Tuesday. Good night.